Well, there's no place like this in the world that's doing not just the research in Alzheimer's disease, but also really focusing on how we can care for patients that are afflicted with some of these devastating diseases more effectively, and not only with patients, but also with their caregivers who are just as important as in part of the treatment. Primarily, I see individuals who have complaints of memory disorders, and many of them, of course, will have Alzheimer's disease, but some not. Some will have other conditions that may be totally treatable or partially treatable. The other group I'm particularly interested in are those who have had repetitive head trauma, either in sports or through the military, because we know some of these individuals will end up with long-term consequences from those earlier injuries. Well, when a patient comes in initially, my mission is really to understand their story. So a lot of it is just listening and trying to understand how they got to the point, what the course of the disease is, because that really helps us diagnose it. I'd rather spend 40 minutes of a 45-minute visit listening to the background and the story and 5 minutes examining the patient than vice versa, because I think that's where you learn really the most. The patient tells you what they have. One of the activities I enjoy, or what I call my drug of choice, is running. So I actually run twice a day, not much, but it's a way to it's a release for me, it's a way to relax, and I guess I get the fitness value of it too, but I think it's more for my mental well-being than the physical part.